An endometrioma is an ovary that contains blood that's from endometrial-like tissue within the ovary. Essentially, when an endometrioma forms, it forms usually at the site of the peritoneum, which is the lining of the abdominal cavity, and the ovary sort of invaginates around it or envelops the endometriosis tissue. And through the stimulation of the endometrial tissue with hormones, there's a bit of a proliferation and a shedding, much like the endometrium itself within the uterus. And over time, that endometrioma can grow thanks to the fluid buildup. But the fluid can't escape the ovary because it's stuck to the peritoneum, it's stuck to a nodule of some kind. And so they can get quite large. I have a patient right now who's got an endometrioma up to 20 centimeters.
Wow.
So they can fill the entire abdomen. Fortunately, most don't get that big, but they can. And having the knowledge of the endometrioma size, the appearance, the location of fixation, where it's adherent, is all really key to that surgical planning if surgery is going to be done.
So it's not really like even it's a cyst at all? Would you think that really?
It's actually not a cyst.
Yeah.
So it's not like a dermoid cyst or a serous cystadenoma, as many people call a simple cyst, follicular cyst type. It's not in the ovary, although it looks like it is because the ovary kind of wraps around it rather than it being truly within. Although there is a one type of endometrioma that's probably the more rare type. It's the origin, probably a metaplastic origin, where there's cells that are within the ovary that somehow change to an endometrial cell. And then those do contain endometrial tissue. And those don't usually get stuck to something because it's a different way that they form. But the primary mechanism by which endometriomas form is this invagination around endometriosis tissue. So it's not a true cyst.
And how does it show up for a patient? And is it fairly common?
Endometriomas are the most common visual cue for endometriosis, though not the most common subtype of endometriosis. The most common subtype is superficial endometriosis. But endometriomas are often what we think of as the tip of the iceberg because they're the easiest thing to find, even on these basic ultrasounds that we've been chatting about. When people view the ovaries, they can see them. But if you don't look for the other forms of endo, you don't see them. So it's sort of the tip of the iceberg. Many patients will present usually with symptoms of pelvic pain, usually cyclical period pain, and they may have pain outside their cycles. And some people will find out about their endometriomas when they are experiencing infertility. And their first gynecologic scan may be with a fertility clinic, and they detect an endometrioma. But unfortunately, a lot of places around the world are still not really using the proper terminology. So they're describing these as complex cysts. We'll see that on a lot of reports. That doesn't tell anybody what it is. It just tells us that it's not something simple or sort of fluid filled with just follicular fluid. And even now we're starting to see a transition to some terminology around the world called the ORADS terminology. It's the ovarian nomenclature amongst radiologists. And they often will say ORADS 2 or ORADS 3, but not actually say that it's an endometrioma. And I really want to help people realize that it's good to characterize something, is it worrisome or not? Is it simple or not? But let's just call it what it is. When it's an endometrioma, we can be quite confident just based on the sonographic ultrasound patterns.